Good afternoon, everyone, and welcome to the Home Health webinar. My name is Linda Ward, and I'm the President and CEO of Gulfside Healthcare Services. I'm delighted that you have joined us today to learn about skilled home health care and how Gulfside Home Health can help those in need and our healthcare community as a whole. First, I would like to welcome and introduce our esteemed expert panelists that will be educating you today. Dr. Lisa Barker is our Medical Director for Gulfside Healthcare Services. Dr. Barker has been with Gulfside since 2016. She recently earned a designation fellow of the American Academy of Hospice and Palliative Medicine, one of the highest honors in her field. She is board certified in family medicine as well as hospice and palliative medicine and is a certified hospice medical director. Dr. Barker also oversees the medical services of Gulfside Home Health. Marcus Bloom is our Gulfside Home Health physical therapist with his doctorate in physical therapy from Cleveland State University. At Gulfside Home Health, Marcus creates and manages all physical therapy care plans for patients in need of physical therapy services. He also oversees the coordination of occupational and speech therapy services. Deborah Coleman is here today, who has recently been promoted to the position of Director of Clinical Social Work Services at Gulfside Healthcare Services. She has been a part of the Gulfside team since 2008, starting as a social worker, caring for patients and their families. Deb is a licensed clinical social worker and qualified supervisor with the Florida Board of Clinical Social Work. Deb has also worked with St. Leo University for the past 6 years as an adjunct professor and liaison. And finally, Tracy McRaven is here today. Tracy is the administrator of Gulfside Home Health. He has worked in the healthcare field since 1992 and received his degree in nursing from Southern Arkansas University in 1996. Prior to receiving his degree in nursing, Tracy also received certifications as a CNA, NREMT, and Army Combat Medic. His focus as a leader is on process improvement based on quality patient care.
All right, our topic today, as you know, is home health care, and we want to share information about all the different types of skilled nursing care that Gulfside Home Health offers, and who can benefit from those services, and the steps for starting that evaluation process. So again, I'd like to introduce Tracy McRaven, the administrator of our Gulfside Home Health. And Tracy, could you please start us out by sharing with us an overview of the services that Gulfside Home Health offers and the areas that we are licensed to cover, please?
Absolutely. Thank you. It's an honor to be here, and thank you for everybody who has joined us. So Gulfside Home Health is licensed in Pasco and Pinellas County. We're able to provide skilled nursing care, physical therapy, occupational therapy, speech therapy, medical social services, and home health aid services to patients in these counties. A lot of things that we do range anything from simple medication management, teaching you medication to be and how to take that correctly, to complex wound care, IV therapy, post-surgical care, and those type of things.
That's great, Tracy. Thank you very much. Something that's important to note is the word skilled. That's what really differentiates Gulfside Home Health from so many other home health agencies. Dr. Barker, as a physician, can you talk about the benefits of receiving those skilled home health services through home care? And do they differ from any non-skilled companion services?
Yes, Linda, thank you. As the slide shows, home health care is really divided into two different categories: skilled home health care and non-skilled home health care. What Gulfside provides is skilled home health care that is provided by licensed staff. This may be a medical social worker, it may be a therapist, such as a physical or occupational therapist. It can also be skilled nursing services, and these can include many things such as wound care, IV therapy and injections, disease monitoring, which is very important for patients that have cardiac or pulmonary diseases, and also testing. So our staff can coordinate with your provider or your physician to be able to obtain the tests that are needed to help guide your care and to coordinate with them. This differs from non-skilled home care. That is care that's more related to meal preparation, house cleaning, help with personal care such as bathing and grooming, shopping, bill paying, assistance with fall prevention and ambulation, reminders to take medication, and just generalized companionship. So these are services that do not require licensed staff to be able to perform.
Thank you, Dr. Barger. That really helps to identify the difference between the two. And we know that the services that patients and their families receive and the care that our patients receive can tremendously help them in the recovery process. But at Gulfside, we also know that there's more to a situation than just someone's physical health. We try to look at the whole picture, assess the whole situation, and that's where our social work services come in. So Deb, can you please talk about how your department and your clinical social workers can help provide that supplemental care?
Absolutely, and I'm so glad that you bring social work up. People often don't know what we do as social workers. And as most of us can probably agree, the healthcare system can be very difficult to navigate. It can be daunting, it can be overwhelming. And as social workers, we walk that process with the patient and the family. So we can start even while the patient's possibly being discharged from the hospital and going back home. We can go ahead and assist with that so that when they get in the home, we can put in place what they need in terms of getting the assistance with the skilled services, linking them to resources, talking about maybe the grief that they're having while the patient is having to do some therapy. It's often difficult to maybe see dad, who was always very strong, now having trouble walking. So we face those challenges with the family together. And studies have shown that the outcome is much better for patients that when they're discharged from the hospital, when they go home with home health. And the social worker is key in just kind of being part of that interdisciplinary team to keep everyone connected. And again, really work with that family to walk along their journey. Our goal is always for the least restrictive environment for the patient. And often patients don't want to go to nursing homes and they don't want to go to assisted living facilities. And if they can go into their home and we can assist with the home health, we are putting them in where they want to be with their family. So we're there not only to assess the physical piece of it, but the mental and emotional that goes along with it.
Thank you, Deb. That's really great. And it really is about the whole person. And at Gulfside Home Health, our interdisciplinary team really has that holistic viewpoint so that the whole person is cared for. So with social work complementing the nursing team and the rehab team, it's just a perfect combination. So let's talk about the therapy side. For someone who's recovering from surgery or an illness, they can receive specialized therapy that they need to recover. Marcus, how does a typical physical therapy visit look, and what's involved on the patient's side and the therapist side? And then how are those visits scheduled?
Yeah, the great thing about physical or home health physical therapy is that we're going to come to the house or to your house. There's no need to go out to an outpatient clinic or to a clinic. We're going to come straight to you. Once we're in the home, we're going to do a thorough evaluation. We're going to look at your strength, how well you're moving, range of motion of your arms, legs. We're going to do a thorough home evaluation. This is just to ensure you're able to get up and down your chair properly. Maybe you're having difficulties getting out of bed. Maybe you're having troubles with your stairs. Once we go over all this, we're going to create a formal plan of care that addresses your needs based off those deficits. Our goal as a physical therapist is to make that as fun as possible for you, for the patient. We're going to get creative. Some things we've done in the past is do different balance activities, whether it's playing a game of cards or putting puzzles together or standing and doing some kind of balance activities. What we ask for the patients is just to be motivated, and we're going to give you exercises to do on your own when we are not there, and we ask you to do those on your own. A typical plan of care, you're looking at about 1 to 3 times per week, up to about 4 weeks. After that fourth week, we will reevaluate you and determine whether or not you need more time.
That's fantastic. And I would imagine such a large majority want to be home, as we've talked about, and having the therapy provided right in the home is just such a special, important feature of recovering. Thank you very much, Marcus. Tracy, you've spent so much time focusing on patient outcomes, quality improvement. What kind of results do patients usually see, and how are those results from home health visits different than the results that we might see from visiting an outpatient rehab center. And then what can patients and their caregivers do to make sure they're getting the most benefit from the care they receive from Gulfside Home Health?
Right. Our goal, one of our core missions is patient-centered care. So what we want to do is we want to make sure that whatever goal that you want to reach, whatever you're looking for, we assist you in moving in that direction. We look at our patient-centered goals. We look at our outcomes and areas of improvement so that we can see where we can do better. So if you look at the slide here, one of the biggest things is when we go to the hospital, we really don't want to go back. It's not fun. It's not fun for us. It's not fun for our family. And especially now with the things that are going on, a lot of times you feel alone. So the national average for rehospitalizations is 17.5%. Our agency, we're able to help with our plan of care and the service that we provide. Our rehospitalization rate is 8%. So you can see you have a 50% chance less likely to go back to the hospital using Gulfside Home Health. On average, national average for number of days that you're being treated by home health is 80 days. Ours is 38. So what does that mean? That means that we are coming to your house less number of times, less chances for you to be to possibly have contamination with the COVID virus and the pandemic that's going on right now. Also, if you're going to a therapy center, not only are you with those therapists, with whoever else is going there, you have that possibility of contacting the COVID virus as well. And one of the big things that Marcus kind of touched on this earlier is when we're at your home, we are personalizing it to your bed, to your chair, to your couch, to your stairs, not a simulated environment that's at a therapy center. So what that does is allows us to get you to your goal, to what you want to be able to do at your home with your actual furniture and your actual living environment. What we see is, as you can tell, that by being able to do that, we're able to get you back to where you want to be faster so that you can move on with your life and have whatever quality of life that you would like to have. One of the biggest things we can do as a family or that you can do as a patient is decide what goals you want to have. What do you want to get out of this care? Have that conversation not only with your family, but absolutely open and honest, realistic expectations, and share that with your healthcare team. Because if you're not fully on board, like Marcus said as well, if you're not ready, if you don't want to participate, and you're not, it's not the direction you want to go, it's going to be difficult to get there. So we want to make sure that it's personalized to you, that we get you to where you want to be, and then you are in control of your healthcare.
That's fantastic. And I hear the passion in each of your presentations, because you really do care about the patients, and being a patient-centered approach to an interdisciplinary provision of care is amazing. And thank you for sharing the rehospitalization rates and the average days receiving home care, and clarifying that 38 days is not 80 days, but we're going to get you back on your feet faster and more comprehensively based on the skilled capacity of our team. So that's, and especially in today's environment. So thank you, Tracy. And really, especially during this pandemic, more people are opting for services that they can have at home. Dr. Barker, could you please touch on why the need for home healthcare is higher now more than ever? And really, what's the benefit to staying home from a medical standpoint?
Absolutely, Linda. With the COVID-19 pandemic, anyone who has a chronic illness is recommended to be homebound. So that has greatly increased the number of people who need to receive care at home. There are lots of reasons for this, and all of my fellow panelists have touched upon reducing their exposure to other patients or to other providers. Also, care in the home is more convenient. It's also safer. You have less risk of falls and accidents in traveling to and from a place to receive service. Decreased travel expenses, just the cost of gas and other transportation to get you there is another reason to think about home health care. Our patients are waiting at home for the provider to arrive rather than waiting in a waiting room where other people have been. And also, as Marcus alluded to, our providers that are coming to give you your care are seeing fewer patients. So rather than being in an outpatient setting where they're possibly seeing 20 or 30 patients a day, our providers are probably only seeing 4 or 5 and taking all the precautions in between. One of the biggest things, and as my background as a family physician, one of the biggest things that I think is wonderful about home health care is the personal relationships that our providers will develop with the patient and with the family. And that is something that is just invaluable to the patient.
That's wonderful. Thank you, Dr. Barker. I think that, from a physician's viewpoint, I think that really holds a lot of value for patients and their families to know that physicians understand the importance of being home and receiving that care. And there's a lot of statistics out there that show the improved outcomes when the person is in their home. So thank you very much. So everyone that's attending today, I just have a couple of questions left to ask our panelists, and then we're going to start taking a look at what's been submitted by each of you as questions. So as a reminder, if you do have a question, please feel free to type that in the Q&A tab, and we'll cover them at the end. So let's talk about something else that's probably on a lot of minds for those who might be considering skilled home health care: the cost. Gulfside Home Health is one of the very few nonprofit skilled home health organizations in the Tampa Bay market. Deb, could you please talk a little bit about the cost of care, insurance, and Medicare coverage, and how does that side work?
Yes, and you are correct. That's probably the first question people want to know. How much is it going to cost? Many people are often on fixed incomes. It really depends on the level of skills that they're going to receive. As Tracy talked about, there's a lot of different services that are provided. Most of the time, Medicare will go ahead and cover that, as well as Medicare Advantage programs. Now, depending on the plan, you may also even get your co-payments paid, deductibles paid. And really, the great thing about home health, as even Tracy discussed, is there's hopefully going to be less possibility and chance that you're going to be going to the hospital, you're going to be going to the ER. Those are so expensive. If any of us have ever been, you get that bill and it's just almost shocking. So with home health, we can stay on top of those things. And so you're saving money in that respect as well. And Gulfside always verifies the insurance and determines the out-of-pocket, so there's no surprises, because no one likes to get that kind of surprise that there's actually monies owed. So it's just such a wonderful program that we do work with so many insurance companies.
That's fantastic and valuable information. Thank you so much, Deb. I know we're throwing a lot of information out there for all of you, and many of you might still think, about, okay, this all sounds great, but where do I really start? Marcus, what's the best way for someone to get started with receiving skilled home health care? Do they need to speak to their physician first, or can they call Gulfside Home Health directly?
Yeah, so our goal is to make it as easy as possible for you. The one thing that we will need is an order from your physician to get started. And we can help you with that. All you need to do is call Gulfside's number, 813-501-8244, and we will help set that up for you. Or maybe you have an upcoming appointment. It's something to address with the doctor. Just go over what problems you're having and see if you can get an order for home health, and we can help you get that process started.
That's fantastic. Yes, we want to make it as simple as possible. Sometimes people say, do I have to call my doctor? And as Marcus was alluding to, you don't have to. We can call them for you. Whatever is going to be the easiest way, I think, our team is here to help. So thank you very much for that. We do have a question that has come up, and thank you for that question. The question is, with hurricane season upon us, what kind of preparations can the Gulfside Home Health team help with for patients at home, potentially with limited mobility in the event of a storm? Tracy, I know that, on the care plan, we addressed that. Are there some things that your team is doing in preparation for hurricane season, and what occurs upon admission for skilled home health patients from our team to help them prepare for those things?
So upon admission, when we go out, we do a full assessment for an emergency plan, find out what the needs are. We set a priority level as far as how quickly we need to do an evacuation. If needed, we also assist with registration for special needs shelters, equipment. If you have oxygen, then we need to make sure you have enough oxygen tanks to last. that sort of thing. So all of that is evaluated. We've come up with a plan on admission, whether it's hurricane season or not. We're preparing for that. So especially with the pandemic going on and the way the emergency services are changing a little bit, we're working with the EOC and to ensure which shelters will be open and where these patients can go if needed.
That's great. So there's peace of mind right from the beginning that, yep, we're right in the middle of hurricane season, but as a Gulfside Home Health team, we're going to take a look at, what your options are, and we'll have a plan in place in case there was an emergency. So thank you very much. So we have another question. Are there any telehealth options available for the home health services? And I know that Dr. Barker, if you could address that from a medical standpoint, and then maybe Deb also, because I know that both of you deal with telehealth for our patients.
Yes, thank you, Linda. I believe that the nurses have the ability to be able to telehealth with your physician, to be able to help with coordination of care. And I'm sure that the other disciplines also have the ability to do that. We would have to coordinate with your provider, your physician, or advanced practice practitioner to be able to coordinate that. But certainly those are services that we can offer. In our other business lines, including palliative care and hospice, our providers have been very active in providing telehealth. And so those opportunities are definitely there for us, and we have all of the hardware and software to be able to accomplish those things.
Great. And Deb, I know that you've been involved in telehealth as well.
Yes, I have, and it's really worked out very well. Obviously, it was something we weren't using before, and then when COVID came, we went ahead and started utilizing it, and it's been so great because often families may not feel comfortable having even us come into the home because here we're out and about, and they worry about the safety of their loved ones and themselves. So we can do a telehealth visit. We will go ahead and use our computer to do it so that we can see the person, see the family, see the patient. And it's actually kind of cute because a lot of the patients really get a kick out of it. They think it's pretty unique that they never thought that they'd actually get to speak to a medical person over a phone or through a computer. So we have found that it's worked out wonderfully.
That's fantastic. And we have on that line, that subject matter, we do have another question. What kind of precautions are staff taking due to COVID? So I would throw that out to Tracy, and then maybe Marcus, you could also address that from a physical therapy standpoint. So Tracy, on the nursing end, what are our precautions?
So we are following the CDC guidelines. We're obviously, anybody suspected or positive for, we wear N95 masks, and obviously the hand washing and clean technique. We clean everything before and after taking care of that patient. Anybody that we do have patients that are COVID positive, and again, we follow the CDC guidelines with the N95 masks and the gowns and all the personal protective equipment to ensure that there's no transmission between us and we don't carry it to somebody else.
That's great. And Marcus, how does that work with physical therapy on the COVID precautions?
Yes, for physical therapy, we're always going to be wearing a mask, gloves, and face shield or glasses when coming in. And if we're using any of our equipment, we are going to, like TheraBands, we're going to give you the equipment and it's yours to have. We're not going to reuse it on new patients. We're not going to take it away from you. Once it's yours, just to kind of eliminate that transmission from patient to patient.
That's great. Yeah, and I will say Gulfside Home Health and Gulfside Healthcare Services have been working diligently on our plans since the inception of the pandemic, and I'm very proud of the team and all the precautions we are taking, and also responding to the community needs. There are calls we're getting from home health, other home health providers, as well as hospitals and the healthcare industry, wanting to see if we would be willing to admit a COVID patient. And while some home health providers might not, we certainly would like to serve the community in any needs that they have. So we have another question. What can caregivers do to make sure their home is ready for a visit? So I'd say that this is probably a good start with Deb.
In terms of having the home ready, there's really nothing that we need specifically, just that they, welcome us in terms of we will wear the proper PPE, we will come in, we will sit wherever they want us to sit with them, and we can talk all about anything that they may need and assist with if they need to get some oxygen or if they need any type of equipment. So we'll help them get the house ready in terms of what they need to get. But there's really nothing that they need to do. That's why we like to come in and just answer any questions and see what we can do to help and just make it easier. Maybe we'll notice that there's a rug that maybe isn't in a good spot and just certain things that we're used to picking up on. So in terms of them, they don't have to do anything.
Well, that's a nice relief. So it's not like cleaning before the cleaner company comes in. And so if our team, is welcomed into a home of a patient, we're going to, as Marcus said earlier too, and Tracy, we're adapting to their home environment, and that really makes a big difference. So reducing that stress ahead of time and not having them have to prepare for anything is great. Thank you for that answer. So at this point, I don't think we have any other questions coming in. And I thank you for your questions today. Those are all wonderful. And I also want you to know that if you still do have some questions, please feel free to call us. We're going to put some information up for you to be able to reach us quickly. And we do have one more poll as we wrap up. And just to gauge where you stand with all the information we gave you today. So if you see a box pop up, just mark the one that's best for you right now. Okay, wonderful. And also today's video video and notes again are going to be emailed out to everyone within 24 hours, posted on our website. And our website is gulfside.org/webinars. And you can always go back and watch this webinar anytime. And we're very happy that you pose the questions to us, and again, our expert panelists have been able to provide information. Gulfside Skilled Home Health is, we're ready, and we're raring to serve you in any capacity. If you're a provider or referral source or a healthcare provider, call us anytime. We'd certainly would love to chat with you and give a little bit more information about our services and help you with the patients that you're serving. But before we completely finish, we have some door prize winners. And so what we're going to do is we've entered each of your names into a poll. And actually, we're going to, who registered, there's a wheel that's going to show up right in front of you. Let me just go out of this here. And we're going to select a random name. We're going to pick 2 names. And after we wrap up, the Gulfside's public relations team is going to contact you as the winners. So we'll go ahead and spin the wheel. So it looks like that's our first winner. Robin, congratulations. And we're going to go again. And Margie is our second winner. So congratulations, you both have won gift certificates. And again, you will be contacted by our Gulfside Public Relations team. So once again, thank you for attending the Gulfside Home Health webinar. Our team is really available 24/7 for you. We can answer any questions you have. If you'd like to set up a free evaluation, don't be afraid to let us know that, because you could just give us a call and say, my mom is at home and she's having difficulty, or, my husband had a hip fracture, and whatever the situation is, or, someone with late stage heart disease that is not doing very well, do they qualify, don't they? Just give us a call. We'll certainly come out and have our nurse come out and evaluate you or your loved one to see if we could start services. So never hesitate. We're always there for you. Again, I would like to thank our panelists, Tracy and Dr. Barker, and Marcus and Deborah. You all were just wonderful and very informative. I'm very honored to have you on the Gulfside team. And to each of you that has joined us today, thank you for being with us. I hope you found this webinar valuable. and have a great day. Thank you.